So when assessing a patient for a mask, for the BiPAP masks, what you need to do is take off their original mask they're wearing, try to keep them on oxygen if that's what they're already on, and use the cutouts from the BiPAP packaging to see whether the patient will be a small or medium. So what you're looking for is that it covers the nose and covers the top of the nose all the way down to just the middle of the chin. You are going to get the majority of patients that struggle to be exactly small, medium or large, but try to make sure that all the areas are covered. When fitting the mask, it's best to do it with 2 people, so you can get an even...
Yeah.
Take the mask over the back of the head, or you'll need to take the hair out. Take the mask over the back and use the clips to seal it. Releasing the Velcro at the top and pulling evenly so the seal comes together. You can adjust this part here so it's more comfortable for the patient. Next, we have 2 filters that go on the BiPAP machine. The green one goes to the patient, and normally you'll have a white or blue one that goes to the machine. It's best to start the machine before you put it on the patient because a lot of patients get quite nervous and jumpy when it first starts. So to start on the machine, you need to make sure it needs to be on passive CPAP for CPAP. So to change, you go to settings and select, and then you go down to mode and modify, and it will be spontaneous timed for BiPAP. During COVID, we're using CPAP. Which can be seen up here. Then you'll go down to the 12 centimetres it's on at the moment, and the doctor will decide what they want to start with, often starting around 6. And then the amount of oxygen is also displayed under here that can be altered. And then it will say activate CPAP, in which you say yes. And calm them and warn them what's going to happen, often slowly putting the mask over their face so they can have an idea of how it feels. And then adding the clips. Right. You can leave their glasses on, and it sometimes helps settle the patient if you leave the glasses on. Leaving dentures in will give structure to the mouth and form a better seal. With some men you will have to shave them in order to get a better seal. Once you've completed that, check your machine to find out what the beeping is. And it will explain things that are happening. So reset this. So here we can see the rest rate and the tidal volume. The doctor should set you a tidal volume, but most people would be between 500 and 700 mils. And the leak should always be below 60. So this is telling us we need to adjust the mask for a better seal. And this could be because the mask doesn't quite fit and this one looks a little bit small. So you would have to adjust it for a bigger size.